One of the things that, Google's really famous for was really understanding the time, the 20% time rule. So again, Google with all the different rules, but to them, I mentioned before it was the 10 and the 20. The 20% time rule was like, hey, this is an opportunity for you. I don't think they have anymore. So that's why, I'm kind of mentioning now, but it was also an opportunity for folks to kind of look at, what things do you want to work on the 20% of the time, right? And that's going to give people the passion to kind of develop stuff. So what are you doing with that time? Are you able to kind of, play with certain things to kind of try different, workflows or, do some experimentation? If you go to a conference, you finding the best practices there, from a workflow standpoint that you can implement to help with wellness programs or other type of programs you can deliver at scale. You take that and, experiment with it, and kind of figure out like what would be some of you can actually use AI to kind of use it as your personal board of directors where you can kind of ask it for feedback on this design. Say, hey, pretend you are a physician, and you're a busy physician, you work this, you're a nurse practitioner, and this is kind of the framework of how you work and when you work, what's the likelihood of you, doing this type of program, right? It can give you some feedback. So at least you kind of can experiment before you actually implement it with your 20% time. The fix isn't more automation, it's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human to human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, put the link below, check it out, and give us a call if it makes sense.